Tonight, more countries are confirming patients with the new coronavirus variant. Portugal, Norway, and Jordan now say they have cases of the new COVID strain. In two of those countries, the patients had been in the United Kingdom where the variant was first detected. So the question is now, when will it show up in the United States? Our senior health correspondent, Monica Robbins, reports.
Every virus mutates. It's what they do to survive. But the variant discovered in the UK, called B.1.1.7, has about 17 mutations. Yeah, that's a lot, because the changes tweaked its genetic code and made it at least 70% more contagious. But so far, it doesn't appear to be more dangerous. First discovered in the UK back in September, it's now in more than 10 other countries, likely already here too.
I would be surprised if there weren't already, I'm afraid, cases in the United States. And this isn't the only variant. As the pressure on the virus grows with natural infection and vaccinations now, we will see evolution in the virus and it will change.
The big question, can the vaccines tackle this variant? Studies are needed to be sure, but Pfizer says it can make changes to its vaccine in about 6 weeks, although a new vaccine would again need FDA approval.
We can directly start to engineer a vaccine which completely mimics this new mutation.
Those studies are underway, but so far the predictions are that the vaccine will work against these new strains, perhaps not quite as effectively as the old strains, but those data are not here yet.
So as for if it's here or not, it has been detected in Canada and health officials are now looking for it, but it's a good bet it's probably already here. And the travel restrictions dozens of countries are implementing, including here in the U.S., may help slow it down some. But the virus will continue to mutate, Romney, which is why people just can't let their guards down even after they've been vaccinated.
Solid advice. Monica, I have to ask, if the virus changes even more, is it possible that in a few months the vaccines won't work anymore?
Well, it's possible they may be less effective, but remember the first two vaccines, the Pfizer and Moderna vaccines, started with more than 90% efficacy. The typical flu shot is about 50% on average. So even if efficacy drops a little bit, it will likely still help, but this is far from over, and researchers are already working on updating these vaccines to deal with the future mutations. And again, we need to study this, and we need to find out if these vaccines will address this particular new variant. But if it doesn't, it's good to know that Pfizer could make a new vaccine in less than 6 weeks.
Good information. Thanks, Monica.